Hello, welcome to Remaking Medicine. I'm Emily F. Peters, here once again to geek out with some of my favorite people in healthcare. This week we have the Andrew Tsang, who is a very sought after guest. He's a rising star in the world of understanding healthcare dynamics, health economics. He's just this incredible voice coming up in our sector, and I'm so excited that he's here today. So, Andrew, why don't you introduce yourself, and then we're going to dive straight in.
Oh goodness, that was, I'll be honest, I was so shocked. I was like, oh, rising star, wow.
You're a rising star.
No big deal. But anyways, no, I'm truly humbled to be here, Emily. I think this is an amazing place to be in terms of just having these great conversations. But yeah, just to introduce myself, Andrew Tsang. I like to say I'm like an aspiring writer. I have in my LinkedIn like real estate novelist, which is like this weird joke to like Billy Joel's like the Piano Man, you know, like the guy who's like corporate and just like yearns for like speaking his truth. And that's kind of how I feel myself right now. So I'm writing about healthcare, but that comes on a whole like background of maybe like a dozen years of healthcare consulting experience. And that's across like all of it. I think providers, payers, pharma, even some policy. And I think that's given me a really good vantage point to work across all these sectors, but also from like, the board executive level down to like the staff level too. And I know what it's like to be in the trenches. And honestly, I just feel it's a great time in my life to start to like share some of that perspective. So I'm really honored and privileged to be here and have the opportunity to just like talk about my experiences and, remaking medicine. It's such a interesting topic.
Wonderful. Yeah, I was saying before we jumped on here that the best part of writing a book, and right now I'm working on Money Remaking Medicine, the third book in our series, is that you get to just find your nerds out in the world and like find these people who are excited to geek out on the same things that I want to geek out on. And, when I first came across your writing, and the ways that you were talking about the different dynamics between all the different players, it reminded me of the like famous meme of the Spider-Mans, right? Of like all the Spider-Men pointing at each other. And that to me is like the best visualization of our healthcare system. It's like everybody points at everyone else and it's like, it's your problem, it's these guys, it's those. And it's like, oh, it's so obviously all of it and the interaction of all of it. And it's so much more big and complicated and intertwined than I think people understand. So yeah, tell me about, you kind of said like pushing the boulder from one piece to the other piece is like a little bit of where you saw your career up to this point, and then now you're like smashing the boulder. Is that what's happening?
It's funny to say that. I guess in a funny way, yes, so right. Like, and I like the way you riffed on kind of like that spider. I mean, there is a lot of that, especially in healthcare, right? It's so easy, and not to I think justifiably so. There is a lot of negativity, right? Oh, it's so bad, it's so tough, and it is really tough, right? It's not a great situation here in the U.S. and in general. I mean, I'll say on balance, there are a lot of other countries who are not happy with their own healthcare systems too. But just kind of like illustrating that a little bit, right? Like it kind of goes back to who I am, I think. I try to be like, I don't know if it's like being like a Asian American immigrant and coming into this country and like feeling like, the Eastern culture and the Western culture, or maybe the idea even as a consultant, right? I'm like neither with them or against them, right? And there's this like idea of kind of being neutral to this that I think is kind of uncommon, especially in the healthcare space where there's a lot of angst and a lot of, sadness and a lot of tough things going on. So going back to what I kind of like shared before, yeah, like I'll be on the provider side, pushing the boulder one way, right? Like maybe figuring out ways to, increase billing and maximize revenue for our health system. And that's a really, I think, critical task. But then I'll just hop over to like the payer side and I'll work on cost containment strategies and, managing utilization. And one of those things, it feels like, okay, what am I really doing here? And not to disparage all the work that all the great people do. I think one of the things though, that even just as myself, I'm trying to think about it, like what's the point of all this thing that we're doing here if we're not making the system actually better?
Yeah. And that is, I think the hardest part is that our healthcare system has evolved into this massive, cloud of confusion. And a lot of people just, the imposter syndrome is so high. Like, how can I don't have a PhD in, the health of the business of health, or the health economics, or, how these systems work. Like, I think a lot of people just get frustrated and don't even, they're not even able to engage in those essential questions. But it sounds like you were able to find your way in, and maybe also because you were using some AI tools, right? That like really helped you to crack through. So talk about like finding that first post that you were working on that you shared with everybody on LinkedIn.
Oh man. Yeah, I think you're right. Like, one, healthcare is super hard to crack.
Mm,
Even people who are like embedded in it. And I've been fortunate to work with like executives of like 20
mm,
plus 30 years, right? I know people who have spent their whole careers here, and like really educated people, like MDs, PhDs, MPHs, MBAs, all the, acronyms, and, people that fill their titles with, obviously. And they're really educated, competent people. And it's still really hard to understand, right?
mhm,
And it can be kind of overwhelming, I think, for
mhm,
even, say, a lay person to get into it and figure out what's going on. And for myself, I consider myself, like a relatively lay person, kind of a chill guy. But I think what really drove me was just like the curiosity to kind of learn
mhm.
more, and obviously connecting it to my work. But even just doing the work, sometimes you're very disconnected from like these macro level, like
Mhm.
policy, like market, economic, even moral things. And to get to the like tactical thing now, yeah, just doing a lot of reading, research. I'll be honest, AI has been a huge like mental unlock for me too. Um,
Mhm.
just being able to like, hey, what are some like books to read? Like, oh, you know what? I'm not really getting this point. Help me like understand this a little bit, right?
Yeah.
Or maybe even more importantly, like trying to articulate my beliefs. I think
Yeah.
that's like the thing that is super underrated for like LLMs and AI, is
Yeah.
that I've been able to say like, man, I really want to express it this way. How can I do that?
Yeah.
And that's really what started me on this whole writing journey. I think it's just a means for me to like express myself and learn and kind of share what I'm learning.
And question. I mean, I think that's the thing. It's like I personally also have been in healthcare forever, and I do feel that like, oh, am I allowed to question this? Am I allowed to be curious about this thing, right? And I really love in your visualizations that there's kind of like a breath of fresh air. Like, let's just see. Let's see what happens if we dial this up, right? And so one of your earlier visualizations that you did was about mapping from like where the money comes in and to where it goes out. And I think Amber can actually pull that. Yeah, this is beautiful. And I think this was really eye-opening in just describing such a complex thing in our healthcare system. What really surprised you about this diagram and the story that this tells?
Well, first, I love that you find it like beautiful. I hear, well, I've shared this with people and they're like, I'm really scared by this. And in a lot of ways, rightfully so. And that's so funny, right? So this
Yeah.
is a Sankey diagram. I used AI obviously to start to compile some of the data to generate
Mhm.
something like this, right? Um, there's a free tool called Sankey-matic, and there's tons of free tools. I post about it all the time on LinkedIn. I'm like, hey, I'm not like a crazy designer, so use these tools. This is just my method of getting to it, right?
Yeah.
And something like this, right? Generating something like to visualize something as complex as the entire U.S. healthcare system, $5 trillion, right? It's crazy. And I pulled this up and I generated something like this. I had to do a lot of cleanup, of course, like fix the fonts, and like it's kind of like cable management. When you're like untangling all these cables, you're like, okay, keep them nice and neat and stuff. Um, the nerds of the household will laugh at that joke. But for the most part, though, like as I was fixing all this stuff, right, I'm like, well, what's the significance of this, right? It's not just here's a chart or here's a bunch of numbers, and yeah, here, taxpayers go to Medicare, which go to
Mhm.
hospitals, right? Like, what's the so what of this, right? Maybe going back to my consulting days. And I tried to pull it a little bit more and think about in here, what is it really saying, right? And it really elicited an emotional reaction from a lot of folks too. I was surprised when I posted this, because when you look at this, you can see like, yeah, it's complicated, it's tangled, but like I was trying to illustrate out, right? Like this is people's lives. This is our system, right? This is
Mhm.
people, you know, there's a prior auth somewhere in there. There's like a prescription in there. There's all the visits. There's end of life conversations. And it's a super like complicated, morally hazardous thing to kind of explore. And I think
Mhm.
framing it in the way of looking at it through like a data visualization is like such a good way to kind of talk about it. So even just to get specific, what surprised me about this was
Mhm.
like, man, what does this say, right? Look how we're all connected to each other is what it is.
Mhm.
You know, if you were to shrink one of the like widths of the lines, it impacts everything else.
Mhm.
And that's the thing that really shocked me the most is like, and maybe it goes back to like my ethos, which is health is other people. I think we're
Mhm.
all kind of in this together. I don't know if that sounds too like highfalutin or preachy, but like we're all in this together. That's what I see. Yeah, it shows
Yeah.
the money, but like this shows how we're all connected to each other. And the only way to fix this thing is to work together to fix it.
Yeah, and I was surprised too seeing on that, that, we talk so much about one of the original sins of the US healthcare system is tying it to employment. And actually the employer's share of healthcare is not the biggest or even the second biggest on that chart. And so it really just helps you, I think, to be able to more easily question some of the statements that are often thrown around about healthcare, right? And the idea that it's not going to care, or that it's going, pharmaceutical drugs are like a huge issue. I mean, I think that that visualization gives you the ability to start to be like, though, is it like, is that narrative right? I think that's the thing that just is so hard about healthcare is there's so many competing forces. Again, that's Spider-Man. And people, are very justifiably trying to stand up for their segment, right? If you're the hospitals, you're trying to say, no, we're not getting enough money, right? Or the pharmacies or the physicians or the patients, and people are advocating for themselves, but there isn't that central just like point of truth of like, what are we really actually talking about? And that's what I love about this visualization is it helps us all see and be like, oh, maybe it's a little different or less bad or also worse than I thought it was, right? As I started to jump in. And then the other visualization I want to have you share too, which really stood out to me, is this idea of the balancing between these 5 pillars, the 5-way seesaw. So tell me about how this idea came up and what this surprised you.
Yeah. So for me, especially working in my experience, like I said, the 4 Ps and whatever, right?
Mhm.
So providers, payers, pharma, even like being a patient, right? Um,
Mhm.
and I had to figure out what to do with like suppliers, but whatever, and government. But the whole point was, yes, there's a lot of different folks, a lot of different Spider-Men, if you will.
Mhm.
And when I thought about it, I was like, okay, I've kind of worn each of those Spider-Man costumes a little bit. And a big part of it is like, okay, who really got the benefit of the healthcare change? If everybody's kind of miserable in it, everybody's blaming someone else, like, how did it really pan out? So honestly, I kind of went on like, I don't know. That's the nice thing. I'll share my like process
Mhm.
too to build this. I kind of wondered, I was like, hey, how can I visualize this? Like, I like the idea of like a seesaw, but then like not just like a single seesaw. Everybody gets how that works. So I thought of like, okay,
Mhm.
let's put the different people on the seats, right? And then started to like play around with like the intuitiveness of it, like the green, the sizes, right, the wins and the loses, right? And then from there, it was able to give me the opportunity to like, okay, so how would it work under different scenarios? What about like the second order effects of like, you know,
Mhm.
5 years from now, 10 years from now? What is each of the stakeholders looking for? And then like the AI piece of it, which
Mhm.
is really cool, is the like scenario modeling. Now this thing is like vibe coded, which means that I kind of just like talked to my AI to make something like this. But like I think there's something there too, because as I generated something like this and it really resonated, like you said, it's kind of silly, right? Like the 5-way seesaw.
Mhm.
Everyone knows how like a seesaw works, but like a 5-way one, what does that mean? So I wrote an essay, I think that really needs to like supplement it because otherwise it's just,
Mhm.
what does this mean? Um, and started to think about like the power dynamics, like who weighs the most on the seat, who's on it, right? Who like what the trade-offs are. People like a 5-way one, how does that really work? And I think that kind of like abstracted like a much more complicated concept
Mhm.
would help people kind of like interpret like, okay, what is actually going on here when we're talking about like healthcare reform, or we're
Yeah.
talking about a new policy, or like a new market strategy, or like a new technology, something that disrupts healthcare. Like what really happens, who wins, who loses.
Yeah.
That's kind of how I thought about the seesaw like analogy.
That's so good. And I think, this is such a powerful tool for, I think one of the frustrations that I see in the market of so many people just say, well, why are we even fighting about it? It's so easy. We just need single payer.
Yeah.
We just need Medicare for all. And you're like, oh, it's just so complicated. I don't want to be that person who's like actually, but but I think that this dynamic, I mean, tell me about the seesaw. You modeled out the seesaw in that scenario, right? How does that work out?
Yeah. Well, I'll tell you right now, one thing that also went into it too, and it's not just like, hey, model out what it works for patients, right? It's very easy to kind of maybe take that implicit bias a little bit.
Yeah.
I think a lot of it went into like the empathy that I gained through my professional career, honestly, because again, I don't want to sound like Pollyanna-ish or like naive, but I don't think anybody wakes up to be a villain, right? I don't think in our healthcare system, I'm sure there's bad apples and, natural caveats of, people who are going to take advantage. But for the most part, everybody I know is trying to help. Like I work with payers, and they're just trying to make sure that their members and subscribers and families that they support get like the right access to care. I know health systems, like major big employers who, have a lot of weight to throw around in the contract negotiations and, utilization stuff. And they're just trying to like serve their communities too, right? The system itself is the hard part, right? So anyways, to just get to what I was talking about, like what was surprising about some of this is that exactly that, right? There's specific policies like, hey, and they're good talking points. And I think not to discredit them, like, again, this is just a vibe coded app. I'm not disclaimer a full health economics researcher.
Yeah.
But to that point though, like if you did say something like Medicare for all, what does that mean, right? When you're at the hospital system, what does that mean for someone who's just trying to tread water? When you're a health plan and you're a payer and I don't know, you manage thousands of lives, hundreds of thousands of lives or whatever like that. Like, what does that really mean? So it's really easy to spew like policy platitudes, I think. And then the operational reality is so disconnected, right? It's really hard for people on the staff level keeping up with the work and the capacity. It's already strained, right? We're talking about even regulators and legislators. Like, it's really hard to do. Like, people say healthcare moves slowly. I have no idea what they're talking about. Like to spend like a week working at these places, it changes every week almost. It feels like, I mean, some things feel like they take forever, but it's hard to do. So when you model out something like Medicare for all, it's like, okay, how long is it going to take to roll something like that out? What does that mean? Who gets impacted? Who loses from decisions like that? And like, what will they do to push back? And how will it really, I guess, affect the intent of the original policy?
That is our question that we're here to talk about today is like, why do good healthcare ideas go bad so often? And I think that 5-way seesaw is such a powerful tool for understanding, like, yes, you can have a policy that is designed to help patients or to help providers, but if you're not considering the whole seesaw, that's where things start to go wrong. Have you looked at ACA through that lens and like thought about how, there were so many things, and there have been some like amazing wins from ACA, but there are things that also just go haywire, right?
Yeah, I totally agree. And that's so funny. I was looking at it just the other day. The ACA is like, what, 15 years old now, essentially?
It feels new, but it's not that new anymore.
Yeah. And obviously, we were in the midst of a government shutdown where, that was a key factor in some of the challenge that's going to happen, right? The ACA of subsidies. And I guess I'll throw it out there, right? Even for this conversation, it can get like dicey. It can be because there's a lot of charge to it. But we're amongst friends here, so I'll speak freely too. But like, what actually happened, right, with the ACA? Well, President Obama won, and he wanted to expand towards like universal coverage, and this was a great rallying cry for people. However, even like through a lot of that work, it wasn't able to just like get flipped on, right? So, but
Mhm.
they did expand coverage. Like I think something like 20 million people got coverage, right? They were gonna hope to like make this marketplace, right? And people remember.
Mhm.
I remember the saying too. It was like, if you like your coverage, you can keep your plan, right?
Mhm.
And it wasn't really like that for a lot of folks. That's the problem too.
Yeah.
Um, and there was just so much variation across the states as
Yeah.
well, with Medicaid expansion. So it worked great for Medicaid expansion states, but for like non-Medicaid expansion states, that left
Yeah.
like a huge gap in uninsured. And like, so even just the original intent of like, hey, let's expand coverage, the AC Affordable Care Act, let's work towards universal coverage, it still left these gaps. Now, I'm not going to say that like it was a mistake or they did wrong, but there was definitely a lot of things that happened along the way
Mhm.
that when we're accounting for, you got to think about like the other stakeholders, you got to think about the, other people on the seesaw. What are they going to do to keep balance, right? So
Yeah.
I think with that in mind, that was probably something that, like a tool like what we just talked about could be useful when you're thinking about potential impacts to these policies.
Yeah. I mean, the road to hell is paved with good intentions is a saying that people have had for hundreds of years for a reason, right?
Yeah.
So we have a comment. Let's do this. Often things look favorable crash because of the losers. To really succeed in a paradigm shift, the strategy has to produce no losers. This is a great comment, a great question, because that's not realistic. You cannot have a change that has no losers in it. Like it is not possible to make everyone succeed equally, fairly across everything all at the same time. What do you think about that question?
I think absolutely right, because it would be great to live in this utopian ideal. But you know what's funny? So I'll throw it out there too. Just I'm gonna do a
Mhm.
side digression here. It's unscripted, guys. I remember posting this, and I got like great feedback. Right, not to like pat myself on the back or anything, but like it was great. Like even like policy researchers reached out to me, like people from nonprofits, and like, oh, we designed this like discrete study of blah, blah, blah. It took 2 years, and then like the seesaw really represented what we were talking about. So I thought it was kind of funny. Like,
Mhm.
but one of the things that they took umbrage with was the idea of like winners and losers. And even though I'm illustrating that in this like seesaw, like there's a win and a loss, and
Mhm.
there are people who lose out, right? I think that's one of the challenges. Going back to this point, though, we're not going to create a world without people feeling like they're losing. But I think that's the challenge here, right?
Mhm.
How can we recognize that we're all in this together? And yeah, people don't want to cede up their piece of the pie, and they're going to
Mhm.
cede their corner. But at the same time, we have to get past like I win, you lose, because then we both lose, right? Um,
Mhm.
it's like fighting an argument with your spouse. You know what I mean?
Yeah.
Even when you win, you lose. So
Right.
what's the point of all that, right? Like, I think in a healthcare ecosystem, there are these critical stakeholders that I've tried to like explain out, like the patients, the providers, right? But like you need things like drug innovation. You need things like payers to manage the
Mhm.
risk, right? We can, point fingers at the insurance companies for sure. And, there's plenty of justification. So, but ultimately someone has to figure out a way to pay for this thing. Right. And
Yeah.
really that's the intent of it. And even the government, it's like, oh, government's in our hands. Like someone has to regulate a lot of this stuff too. And although it's very easy to say one particular Spider-Man is guilty of the bad healthcare system,
Yeah.
we all have a part in this. So again, I don't want to
Mhm.
seem Pollyannish or like too out there, but like, how do we design a policy that doesn't make any losers? Not possible. But the
Yeah.
best thing is that like I'm willing to lose a little bit to help my neighbor. I'm willing to lose a little bit to make this better. You know what I mean? I'm willing to compromise and to cede a point to my wife so that we can not,
Yeah.
because that's the
Yeah.
state that we're in right now.
There's a great book, a children's book that has this character, the Fair Fairy, right? And the kids come to her and they're like, hey, my friend got ice cream and I didn't get ice cream. And the Fair Fairy is supposed to resolve this, right? And
Mhm.
every scene that the Fair Fairy's in, it starts with, okay, well, I'll give you ice cream too. And then the other kid's like, no, but that's chocolate chip ice cream and I had vanilla. And then like, okay, well, I'm going to give you a cookie. And then it's not fair. And then like this balancing back and forth. And it ends, of course, with the Fair Fairy having like a panic attack and smashing everything and like you get nothing, smash, and like you get nothing, smash. And I do think so much of our current healthcare system right now is this big existential question about what is fair, right? What is fair in terms of, a highly specialized surgeon who spent way more time getting medical education and time and cost, getting paid, 6 times more than the primary care doctor. Is that fair, right? What is fair for you as an individual, right? This is a deeply American question around, like, so if you eat terrible junk food all day and you don't exercise and then you have these health outcomes, is it fair that you're going to pay the same amount as me? That's like such an American way of thinking about like what is fair, right? And you have this quote that you shared around, it really is fixing the culture before fixing the system is maybe the way we need to be thinking about healthcare, and having these big questions around what is fair. How do we even think about what is fair? And these are really the things that we're trying, ultimately the things that we do need to solve is that question. And instead, what we do is Spider-Man it. And we just, it's not fair that hospitals should be getting paid more. And it's not fair that, pediatrics doesn't get paid more. And it's not fair for me as a consumer to spend, this much money out of pocket when that person over there who's on, Medicare doesn't have to pay. And it just becomes this like, we spend so much time and energy in our healthcare system with RVUs, HEDIS scores, CPT codes, ICD-10 codes, like all, when we talk about administrative burden, that is a burden of a system trying to have this utopian world where we can say that this is fair. Everything's going to be fair. Everyone's going to get paid fairly.
Yep.
No minute is going to get billed incorrectly. What do you think about that? Like the fairness dynamic in healthcare?
I think you nailed it. And that's something that is like an insider would know, like the RVUs, the HEDIS measurement, like it really is, like, don't get me wrong. I think the intent is great for basically all this stuff and it makes sense. But it's duct taping over the problem, right? It's just like this fix for something that at the foundation we never really addressed.
Yeah.
And that's really this core philosophy. And sometimes, again, like philosophy is something that people like overlook. But I think in this day and age of AI, we should be questioning our values more than ever. Anyways, I digress. But for the point of healthcare, that's the whole thing, right? We really need to think about, not just what is fair in terms of like, the 50 states and do they get equitable amount of things, or, the people who have suffered disproportionately historically, right? We're talking racial, ethnic groups, genders, right? Like women typically are not like researched and studied as much. And I'm not pandering, I swear. But to that point, as a country, if we're designing the system and we're all part of the system, we're not waiting for a Superman to come and design the system for us, right? We have a voice to say, then we have to answer that question. What is like fair? What is reasonable? How do we actually believe that people should live and die? Do we believe that people should go into poverty because they got sick, they got unlucky? Do we believe that, I don't know, the elderly who like really contributed to the foundation and contributions of our society should age into like, squalor and relevance and with awful health conditions? Like we have to really think about that, and we really haven't collectively, like no one's going to call like a town meeting and
family meeting for the entire United States. Let's do it. I mean, there is a lot of talk about participatory governing being the thing that builds trust and builds, I'm ready. Let's do like a national campaign of like, let's get everyone to weigh in and vote what they think is fair. Let's have everyone talk about it, because honestly, we're not making any progress the way it's been going so far. I think we're having irrational, unreasonable conversations on all sides, and we're not getting anywhere. And one of the challenges too is that because we are such a massive country, and even just here in California, we have 58 counties. Like, what if one county really figures it out, right? And like creates a universal healthcare, and they cover it for everybody, and it's free. Is everybody just going to move to that city, like to that county, to that state? Like, what does that look like in terms of, as we try to create policies across the US, there's a lot of strength in the diversity of each county and each state and each program having its own way of approaching it. But also then, you know, what does that look like if one state does figure it out? Can other people just move there and jump in on that? Like, what does that look like, right?
Yeah. Everybody moves to Napa County. They're like, oh yeah, you know what? They really got it going here.
Yeah, I mean, Vermont really tried to implement universal, like universal healthcare, single payer healthcare several times, and they ultimately just decided it was not affordable, and it was not financially viable. It would have bankrupted the state, right? And so I think there are a lot of lessons out there of like, yes, it is so complex, and yes, it is like and you know, actually kind of conversation, but there are also a lot of success stories, right, in the market too. And like, you know, Los Angeles has a public option on its marketplace that you can buy into. It is doing Medicare for all, right, basically in Los Angeles. And there are lots of like points of light of that we can point to. What are things that you are seeing that are making you feel more optimistic about where we're headed?
Healthcare wise, oh gosh.
Or do you feel optimistic? Not
No,
yet.
I do. I'm generally like not. I'm a bit of a cynic sometimes, but I
Mhm.
am like optimistic. Um, Gosh. Okay, so I think people are against, and I'm kind of riffing on this a little bit
Yeah.
here, but are against the idea of like a huge consolidation and like big, like, you know, dominant players. But like there is some aspect of like vertical integration that works well. I think, like for example,
Mhm.
Kaiser Permanente is like a pretty well established system that has that where they're trying to align the incentives of the providers along with the payers, right? So there's some
Mhm.
value there. Um, I think, you know, other like states too, I think they take a different approach to, you mentioned like Vermont, right? I mean, jury's out a little bit, but like even like Maryland, they do like this all payer kind of rate setting thing
Mhm.
there. And it's very different, right? And you've got like great health systems there, like Johns Hopkins and so
Mhm.
forth, right? Um, it is like doable, right? Where I think
Mhm.
the problems in healthcare that we're really trying to solve for, we're not getting the most value, the best health outcomes for what we spend, right?
Mhm.
So for me, like the points of light and the things that would be most hopeful are where we're really understanding the costs that we're trying to spend our health on, and
Mhm.
also obviously creating better health outcomes too. But that's like
Mhm.
very generic. It's too high level. I think another thing that's really giving me hope too, and I'll kind of choose it to my prep answer that I was thinking about. Like just having conversations about this. I think that's one thing, right? Maybe this is like a phase shift in our like healthcare era where hopefully people are becoming more aware, more literate about like the system that we're all kind of like in, right? It's like the water that we're swimming in. Like you're a fish, and you're like, do fish even know that they're in water right now?
Mhm.
But like people are, right? Like healthcare is at the top of a lot of conversations, I think, in the economy,
Mhm.
morally, philosophically, right? Um,
Mhm.
and that's something I think is really hopeful. I've really enjoyed being able to participate in more conversations. And I hope that by having conversations like this is like a sign of hope that
Yeah.
we can introduce these complex problems that were hidden behind these academic journals and like, you know, industry white papers and all these
Yeah.
things. We can kind of bring it forth and, you know, figure out a way to actually talk about this publicly.
I like that. It's very meta, but it's so true. I mean, honestly, there's a lot of people when I say I'm writing a book about money and medicine, they're like, that's so great. I want to read that. But there are also a lot of people who are like, I don't think you should write that book. Right. And they're just like,
Gotten
oh,
that.
like, oh, do you have like a PhD in economics? Like, who are you to write that book? And I'm joking, like throughout the book, I almost want to have like, there's this like voice of the healthcare system, like that just like is so pervasive of being like, don't write it, don't ask about it, like, don't worry about it, you shouldn't write it, you know? And I think just by being able to joyfully and curiously at least ask questions about it, like what is really happening, like that is just a big culture change in itself, right? Like let's talk. And things can actually really change. Nothing is set in stone. Things have changed so much in healthcare in the 150 years of the American healthcare system that we have here. Like, it's a fascinating, very rich text, right? And yeah, good shout out to Kaiser. I am a Kaiser member, which is fascinating to like live in this alternate dimension of medicine. And Forbes just named them the top value business in the United States, above Costco and above Trader Joe's and Toyota and all these other companies, which is fascinating because it's so expensive still. I mean, I pay $2,000 a month for my family's health insurance on Kaiser, and it genuinely is a good value, like, which is just the wild, like, what else do you spend that much money on that you would say, yeah, like that actually kind of works out. And to have a system, yeah. And can we scale it? Is there, the HMO, we tried it. It did save a lot of money, but culturally we could not, as Americans, have a lot of cultural reasons that the HMO push in the 90s failed. And it was because we didn't want to relinquish decision-making. We didn't want to be part of a larger system. There was a lot of lobbying that helped us to think that way too at the time. But it all ultimately does come down to culture change. Like you, I think, very smartly said, like, how can we try to shift just even like the way that we're thinking about some pieces of this, right? And always asking too, like when we talk about, if there's like a big story of like, rural hospitals are going to go under with Medicaid cuts. Okay. But like who is saying that, right? And like what representation are they bringing to that story, right? And like just like really questioning. It's not like a criticism. Like of course, rural hospitals, we want them when we need them and we want them to succeed, and we're not trying to attack them. But let's just ask questions, right, about their funding and like what is happening in that setting. And I think the work that you're doing with your data visualizations are really helping to crack that kind of thing open. It's so great.
Yeah, I think so. I think the first thing to fixing a problem is acknowledging that we have one. And everybody knows that we've got like a healthcare industry problem in the United States, for sure. But like, what is it, right? Like, and there is like, like Uwe Reinhardt, the famous, Princeton economist. He wrote like, it's the prices, stupid, right? Like it's very, very succinctly explained what the issue is. But like, to your point though, like, I think being able to have those conversations, and even that, like this great world leading economist wrote it like, hey, stupid, like that. I love that. That's such a succinct message. And that's really what I'm hoping to get out there too, especially with talking about healthcare in like this way. Make it accessible, make it something that we can interpret and digest and really understand like the impacts of our decisions, which I think is the biggest difference. Is that sometimes we're so abstracted and removed from it. It's hard to really understand like, hey, what is it I'm actually doing here? And what is the outcome I'm really driving for? Not the thing that I said I was trying to do.
So many acronyms, right? Revenue cycle, RCM optimization. You're like, what is, like, let's use like plain language. What are you trying to say that you're trying to do?
Yeah, I'm sure that was like some MBA's wet dream, like revenue cycle. It's so ambiguous. I love it.
RCM just sounds so innocuous. And then you're like, wait, but where's that money coming from that we're optimizing? Who is paying for that? What does that really look like, right? We've bundled all this into so much, sugar coating. It's very difficult to understand really what is happening in our healthcare system. Okay, so we have 2 more questions here. We're almost at our time. So tell me about things that you're reading or things, where you're looking to inspiration, getting new ideas about tackling new sides of the healthcare system.
Yeah. Well, I'm on a pander here. I've started reading Artists Remaking Medicine.
Oh, I might just have a copy. Let's hold up a copy.
Yeah.
Hey!
Thank you for sending that to me. And then I am reading actually. So it's so funny. Like I have kids now, and I don't have like time to like read, but I've really become like fascinated with this stuff. And like to write, you have to like read. So I'm reading. And by the way, social media is like a great tool. By the way, everybody should be posting on LinkedIn. Like just send like a beacon out, like, hey, what book should I read? And you'll get like a response. And then, by the way, just go out and like buy that book and then read it. And you've earned like a ton of credibility in the eyes of the person that recommended it, by the way, just like free life hack.
Team books all the way.
But even like I remember like like Eric Bricker is like our like mini celebrity on like LinkedIn, right? He's got like, but he recommended on like a podcast like, hey, read The Hospital, which is like a nonfiction story about a rural hospital in Ohio, and it talks about it like the lived like what does the CEO's day to day like literally look like? Oh, he's wiping the snow off his car, and he's trying to go to a board meeting, and he's like sweating because like he's worried about the finances, right? And I love that. So I've been reading stuff like this to kind of get inspired a little bit of the people who are in this system who work every day to fix this. I read like policy theory and stuff like that. I read. I think the humanities is really good. I really like Atul Gawande. He's like my idol. So like reading some of those books, like the Checklist Manifesto, has been like eye-opening to me. So yeah, I mean that's where I've been doing a lot of reading lately, particularly around healthcare.
Yeah, like you said, it all comes down to the humans. There are so many incredible people, millions of incredible people who are in our healthcare system. And it's about finding a way to take all that positive energy and to push it in the direction that we want, to the outcomes that we want. I mean, these are not any of us who have been a patient, which is all of us, have experienced those common sense, just everyday things. You're like, why is it like this? And I would love that more energy towards asking those questions and thinking about it and thinking how we fix it. So where can we find you? Where should people be following you? You have a Substack, you have a LinkedIn. Give us the shout out.
Yeah, well, obviously you guys can find me on LinkedIn where you guys are watching this and inevitably, I guess, following my posts, which is cool. I'm also started a Substack and I'm trying to get better about posting to it regularly, but I did post one just last week. It's solid, I think. It's Health is Other People. Substack.com. I gotta pat myself on the back for how clever Health is Other People is. It's just this whole nod to like John Paul Sartre's like no exit, like hell is other people, which yeah, I know. It's like this whole like existentialist philosophy, right? And the idea is that I'm not gonna get all philosophical real quick, but existence precedes essence, right? Like you are what you do, not what you say you do, right? You can't say you're a good person and not do good things, which is like the crux of the play. He didn't want to be a coward, but he did like cowardly things. And that's what it is with our healthcare system, right? Like it says it's here for, the patients, the providers, for the people. And it's just like, what are we doing here? So I guess find me on Health is Other People. Please subscribe. I don't even charge at all, so it's all free stuff. But yeah, oh look, the link. Go to that. That'd be cool. Reach me there, and maybe if I write a book someday, which I really, really am gonna pour my heart out into doing, hopefully you guys can read that too.
So good. I love that we get to end this conversation on existentialism and the nature of hypocrisy and morality, because it really that is. Every choice that we're making in our healthcare system does have this really deep cultural backing to it of like why we chose it that way. Why is it like that? It's just such a fascinating, rich piece of text. And, we're really in it right now as a country in terms of like, what are these conversations and what are these decisions and how do we move forward? In some ways that's really terrifying, but also in some ways that's exciting. Maybe we're ready to have these conversations in a new way, right? And to get together and to think about how do we explore these balances and winners and losers and what's fair and where do we want to go as a country? And Andrew, you're helping lead those conversations, which is so wonderful.
I hope, yeah. Well, I mean, it takes multiple people to have a conversation, so hopefully other people join in too. I don't know, leading anything, but at the same time, I'm just really glad to, have my voice come out.
Oh, so good. Well, I hope everybody goes to your Substack. I hope that they go check out your incredible visualizations. I can't wait to see what you come up with next. Thank you so much for joining us today. This was fascinating conversation. I'm sure there's going to be tons more comments. I know we already answered a couple in our discussion, but there's more on LinkedIn. And yeah, just keep it going. I'm really excited that we get to be nerd friends in the work of Remaking Medicine.
Well, thank you so much for your support. It's been great to be here.
Yeah, thank you.